Tell me about your experience as a nurse.
My nursing career began over 7 years ago, and for the majority of that time, I've specialized in critical care, working in a busy intensive care unit at City Hospital. In this role, I honed my skills in managing complex patient conditions, including post-surgical recovery, severe respiratory distress, and sepsis. I became proficient in monitoring advanced hemodynamics, titrating vasoactive medications, and operating sophisticated life support equipment. Beyond the technical aspects, a significant part of my experience involved patient advocacy and family communication. I often found myself translating complex medical jargon into understandable terms for anxious families, ensuring they felt informed and supported during incredibly difficult times. Before specializing, I gained a strong foundation in medical surgical nursing for 2 years, where I managed a diverse caseload of patients with various acute and chronic conditions. This generalist experience provided me with a robust understanding of holistic patient assessment, medication management, wound care, and discharge planning. I also regularly participated in interdisciplinary team rounds, collaborating closely with physicians, pharmacists, and allied health professionals to develop comprehensive care plans. This commitment to teamwork and continuous learning has been central to my practice, enabling me to adapt quickly to new challenges and contribute effectively to positive patient outcomes.
Describe a challenging patient case you've managed. What was the outcome, and what did you learn?
One of the most challenging patient cases I managed involved a 45-year-old male, Mr. Andrew, admitted to the ICU with severe acute pancreatitis complicated by multi-organ dysfunction, including acute kidney injury and respiratory failure requiring mechanical ventilation. His condition was rapidly deteriorating, and his family, who had limited understanding of his prognosis, was becoming increasingly distressed and demanding. My primary task was to meticulously monitor his complex vitals, manage multiple infusions, ensure ventilator synchrony, and administer critical care in accordance with his physician's orders. However, the true challenge lay in navigating the family's emotional state. They were struggling to accept the severity of his illness, often expressing anger and questioning every intervention. They frequently requested constant updates and struggled to comprehend the nuances of his fluctuating condition, sometimes interpreting small improvements as a sign he was ready to go home. To address this, I initiated a more structured communication approach. Each shift, I dedicated specific, uninterrupted time to speak with the family, often inviting the physician to join when possible. I used simplified language, drawing diagrams to explain organ function and the purpose of different machines. I also empathetically acknowledged their fear and frustration, validating their feelings while gently reiterating the realities of his critical state. I actively listened to their concerns, providing them with a safe space to express their anxieties. I also worked closely with the palliative care team to introduce the concept of advanced care planning gently, ensuring all options were understood. Through consistent, empathetic, and transparent communication, the family gradually began to grasp the gravity of Mr. Andrews' situation. While his journey was prolonged and fraught with complications, he eventually stabilized enough to be weaned off the ventilator and transferred to a step-down unit. He made a slow but significant recovery, eventually being discharged to a rehabilitation facility. What I learned profoundly from this case is the immense importance of compassionate communication as a clinical intervention. It taught me that sometimes managing the emotional distress of a patient's family is as critical as managing their physical symptoms. It reinforced the need for patience, active listening, and the ability to tailor information delivery to different levels of understanding. This experience solidified my belief that building trust and rapport with families not only improves their coping, but also indirectly contributes to better patient outcomes by fostering a collaborative care environment.
How do you prioritize patient care when you have multiple competing demands? Give an example.
Prioritizing patient care with multiple competing demands is a constant reality in nursing, and my approach is always guided by a framework of patient safety, acuity, and immediate needs. I mentally categorize tasks, utilizing critical thinking to assess which interventions are time-sensitive and which patients are at the highest risk. This often means employing strategies like the ABCs: airway, breathing, circulation, Maslow's hierarchy of needs, and the least restrictive, most effective principle. I also leverage technology, like electronic health records, to quickly review patient data and identify immediate alerts. For example, on a recent shift, I was caring for 4 patients on a medical surgical unit. One patient, an elderly gentleman recovering from hip surgery, needed his pain medication administered promptly before physical therapy. Another patient, who had just returned from a procedure, was due for vital signs and a post-op assessment. My third patient was requesting assistance to the bathroom, and the fourth, a diabetic, had just received insulin and was due for a blood glucose check. My immediate priority became the diabetic patient. While the pain medication was important for comfort and mobility, a delayed blood glucose check after insulin could lead to a severe hypoglycemic event, which is a life-threatening emergency. After ensuring the blood glucose was done and the patient was stable, I then assessed the post-op patient. Their vital signs and initial assessment were crucial to detect any immediate complications from the procedure. Following that, I administered the pain medication to the post-op patient, ensuring he could participate in his therapy. Finally, I assisted the patient to the bathroom, as this was a comfort and dignity need, but not as acutely life-threatening as the other two. Throughout this, I was also continuously performing quick visual checks on all patients, listening for alarms, and being prepared to reassess priorities at any moment if a patient's condition changed. This systematic approach ensures that the most critical needs are always addressed first, while still aiming to meet all patient needs efficiently.
Describe a time you made a mistake. How did you handle it, and what was the outcome?
Mistakes are inevitable in any profession, and nursing is no exception. A few years ago, I was administering medications on a busy morning shift. I had a patient, Mr. Lee, who was prescribed a specific dose of an oral antibiotic. In my haste, I accidentally pulled out a tablet that was double the prescribed dosage for him. Fortunately, just as I was about to administer it, I paused. It was a brief moment, but something fell off. I double-checked the medication against the physician's order and immediately realized my error. The dose I had was 500 milligrams, but the order was for 250 milligrams. My immediate action was to not administer the incorrect dose. I put the incorrect tablet aside, retrieved the correct 250 milligrams tablet, and administered that to Mr. Lee. Following that, I immediately reported the near miss to my charge nurse and documented it in our hospital's incident reporting system. I explained exactly what happened, including the specific medication and dose, and emphasized that the patient received the correct medication and suffered no harm. I also took a moment to reflect on why the error occurred. It was primarily due to rushing and not fully engaging in my mental 5 rights check, specifically the right dose and right medication prior to picking it up. The outcome was positive for the patient, as he received the correct medication and was unharmed. For me, it was a crucial learning experience. It reinforced the absolute necessity of strict adherence to medication administration protocols, no matter how busy the shift or how familiar you are with a medication. It taught me the power of that final pause, the importance of a meticulous double-check, and the value of self-correction and transparent reporting. This experience strengthened my commitment to patient safety and made me even more vigilant in my medication practices.
How do you stay current with the latest medical advancements and best practices in nursing?
Staying current with the latest medical advancements and best practices in nursing is an essential part of my professional commitment. I believe in continuous learning to ensure I deliver evidence-based, high-quality care to my patients. My approach is structured and incorporates multiple learning methods to keep my knowledge and skills up to date. First, I actively engage with professional nursing literature by subscribing to and regularly reading reputable journals such as the Journal of Advanced Nursing and American Journal of Nursing. These peer-reviewed publications provide critical insights into new research findings, updated clinical guidelines, and emerging healthcare technologies. Additionally, I follow updates from key nursing organizations, including the American Nurses Association and specialty-specific associations, through their newsletters and online platforms. These sources help me stay informed about policy changes and best practice recommendations. Second, I prioritize continuing professional development by attending relevant conferences, workshops, and webinars. Recently, I participated in a virtual conference on advances in pediatric vaccination protocols, which deepened my understanding of new immunization guidelines. These events are invaluable for both formal education and networking, allowing me to exchange knowledge with peers and experts in the field. Third, I embrace interdisciplinary collaboration as a key learning opportunity. I actively participate in ward rounds, team meetings, and case discussions with physicians, pharmacists, and other healthcare professionals. These interactions expose me to new treatment approaches, medication updates, and innovative patient care strategies. I also seek mentorship and informal learning from experienced colleagues, as real-world clinical insights enhance my practice in ways that textbooks alone cannot. Finally, I ensure compliance with the latest institutional standards by completing hospital-mandated training modules and reviewing policy updates. This helps me align my practice with current protocols, safety measures, and technological advancements within my workplace. By combining structured education, peer collaboration, and hands-on learning, I maintain a dynamic and up-to-date nursing practice that prioritizes patient safety and high-quality care.
Walk me through your assessment process for a patient presenting with a chest pain.
When assessing a patient presenting with chest pain, I follow a structured yet flexible approach to ensure timely identification of any life-threatening conditions while addressing the patient's comfort and concerns. I begin by quickly evaluating the patient's airway, breathing, and circulation to ensure they are stable. If there are any signs of distress, I initiate emergency protocols and alert the appropriate team immediately. Assuming the patient is stable, I move into a focused subjective assessment using the PQRST method to understand the nature of the pain. I ask about the provocation, what brings it on or makes it better, quality, how the pain feels, sharp, dull, crushing, region and radiation, where it is located and whether it spreads, severity on a scale of 0 to 10, and timing, when it started and whether it has changed. This helps me begin to differentiate between cardiac and non-cardiac causes. Simultaneously, I perform a physical assessment, checking vital signs, oxygen saturation, skin color, and temperature. I listen for abnormal heart or lung sounds and observe for signs like diaphoresis or shortness of breath. I also assess risk factors such as age, medical history, lifestyle, and family history of cardiac issues. If the chest pain appears to be cardiac-related, I ensure an ECG is performed promptly, initiate oxygen if indicated, and prepare for the administration of medications like nitrates or aspirin per standing orders or physician directives. Throughout the process, I maintain communication with the patient, explaining each step to help reduce anxiety, and I document all findings meticulously. Overall, my assessment is systematic but responsive, always prioritizing patient safety while coordinating effectively with the healthcare team to guide appropriate interventions.
How do you handle rapid responses or emergency situations?
Handling rapid responses or emergency situations is a core aspect of critical care nursing, and my approach is always centered on immediate assessment, clear communication, and decisive action within a team-oriented framework. When a rapid response or code blue is called, my first step is to quickly assess the patient's immediate ABCs, airway, breathing, circulation, to understand the nature and severity of the emergency. This involves a rapid visual scan and assessment of their responsiveness, breathing pattern, and pulse. Simultaneously, I ensure clear and concise communication. If I'm the first responder, I immediately call for help, stating the patient's location and the nature of the emergency. Once the team arrives, I provide a quick, focused handover, detailing the patient's baseline, the sudden change, and any interventions already initiated. I then assume a role based on the team's needs and my own strengths, often taking on responsibilities like managing the airway, administering medications, or running the code card, always anticipating the next steps. My actions are then guided by established protocols and algorithms, such as ACLS, Advanced Cardiovascular Life Support, guidelines, ensuring that critical interventions are performed efficiently and effectively. I remain calm under pressure, which is vital for maintaining a controlled environment and facilitating clear decision-making. I also prioritize documentation of events and interventions as accurately and concurrently as possible to ensure a complete record for ongoing care and future analysis. After the immediate crisis is stabilized, I participate in debriefing sessions with the team to review what went well, identify areas for improvement, and integrate those learnings into future practice. This systematic yet adaptable approach allows me to contribute effectively to saving lives and ensuring the best possible outcome in high-stakes situations.
Describe your experience with EMR systems.
Throughout my nursing career, I have gained extensive experience working with various electronic medical record (EMR) systems, which I consider an essential tool for delivering safe, efficient, and patient-centered care. My proficiency spans documentation, order management, clinical decision support, and interdisciplinary communication within these platforms. I am adept at performing comprehensive patient charting, including real-time documentation of assessments, interventions, and progress notes, ensuring accuracy and compliance with institutional and regulatory standards. I regularly utilize EMR systems to review patient histories, medication lists, and diagnostic results, which allows me to identify trends, prevent errors, and provide informed care. For example, I rely on medication reconciliation tools to verify prescriptions, check for interactions, and ensure timely administration, significantly reducing the risk of adverse drug events. Additionally, I leverage EMR functionalities to streamline workflows, such as creating customized templates for frequent documentation needs, setting up alerts for critical lab values, and using order entry systems to expedite diagnostic tests or consultations. I also appreciate the role of EMRs in enhancing team collaboration, whether through secure messaging with physicians, updating care plans accessible to all providers, or participating in shift handovers using structured digital reports. Having worked with systems like Epic, Cerner, and Meditech, I adapt quickly to new platforms and recognize the importance of ongoing training to maximize their potential. I actively participate in EMR optimization initiatives, such as providing feedback to IT teams to improve usability or training new staff on system functionalities. My goal is always to use technology not just as an administrative tool, but as a means to enhance clinical decision-making, patient safety, and interdisciplinary coordination. In summary, my experience with EMR systems has strengthened my ability to deliver precise, efficient, and coordinated care while maintaining rigorous standards of data integrity and patient privacy. I am committed to leveraging these systems to their fullest capacity to support optimal patient outcomes.
How do you explain complex medical information to patients and their families in an easy-to-understand way?
Effectively explaining complex medical information to patients and families is a critical part of nursing care, as understanding directly impacts their ability to participate in treatment decisions and follow care plans. My approach centers on clarity, empathy, and active engagement to ensure comprehension without overwhelming them. First, I assess their baseline understanding and preferences. Some patients want detailed explanations, while others prefer simpler summaries. I use plain language, avoiding medical jargon, and relate concepts to everyday experiences. For example, if explaining hypertension, I might compare blood vessels to garden hoses under pressure, where too much force over time can cause damage. Visual aids, such as diagrams or models, are invaluable for illustrating anatomy or procedures like how a stent opens a blocked artery. I break information into smaller, manageable parts and check for understanding after each segment using the teach-back method, asking them to explain it back in their own words. This helps me identify gaps to clarify. I also encourage questions and welcome interruptions, as this dialogue builds trust and ensures they leave confident. For ongoing conditions like diabetes, I provide written summaries or reliable resources to reinforce teaching. Most importantly, I tailor my approach to cultural, educational, and emotional needs, recognizing that stress can hinder retention. By combining patience, creativity, and active listening, I empower patients and families to make informed decisions about their care.
Describe a time you had to deal with a difficult patient or family member. How did you resolve the situation?
I recall caring for an elderly patient with advanced dementia whose daughter was visibly distressed and often confrontational with staff. She frequently accused the team of not providing adequate care, despite our efforts to keep her mother comfortable. Recognizing her frustration stemmed from fear and helplessness, I approached the situation with empathy and active listening. First, I set aside time to sit with the daughter privately, allowing her to express her concerns without interruption. I validated her feelings by saying, "I can see how much you love your mother, and it's hard to see her like this. Let's work together to address your worries." This helped de-escalate tensions and build rapport. Next, I provided clear, consistent updates about her mother's condition in simple terms, using visual aids like the whiteboard in the room to outline daily care plans. I also involved her in small, manageable care tasks, like assisting with moisturizing her mother's hands, to help her feel more connected and empowered. When she raised concerns about medication delays, I investigated promptly, discovered a pharmacy delay, and transparently explained the issue while outlining steps to prevent recurrence. I collaborated with the charge nurse to provide hourly rounding updates, which reassured her. By combining transparency, compassion, and proactive problem-solving, the daughter's trust in the team grew. She later thanked us for our patience and teamwork. This experience reinforced how addressing emotions first and involving families in care can transform difficult interactions into collaborative partnerships.
How do you collaborate with physicians, other nurses, and other healthcare professionals to ensure optimal patient outcomes?
Collaboration with the healthcare team is fundamental to delivering safe, effective, and patient-centered care. My approach is rooted in clear communication, mutual respect, and a shared commitment to the patient's well-being. When working with physicians, I ensure concise, relevant information is communicated using the SBAR, Situation Background Assessment Recommendation, format. For example, if a patient's condition deteriorates, I present a structured update. Dr. Lee, this is Sarah from Ward 4. Mr. John, our 68-year-old COPD patient, has developed increased wheezing and dropping SpO2 to 88% on room air over the past hour. He's on 2L oxygen via nasal cannula, but his respiratory rate remains 28. I'm concerned about possible pneumonia. Would you consider a stat chest X-ray and ABGs? This method promotes efficient decision-making while demonstrating clinical judgment. With fellow nurses, I foster teamwork through active listening and peer support. During shift handovers, I use standardized tools like ISBAR to prevent omissions. If a colleague misses a medication due to an emergency, I step in to assist without judgment, then debrief afterward to identify system improvements, like adjusting assignment acuity levels. For allied health professionals, I prioritize interdisciplinary rounds and shared goal setting. For instance, with a post-stroke patient, I collaborate with physiotherapists on mobility schedules, consult dietitians for swallow assessments, and coordinate with social workers for discharge planning. I document all updates in the EMR in real time to keep the team aligned. When conflicts arise, such as differing opinions on pain management, I focus on evidence-based solutions. Recently, a resident preferred increasing opioids for a postoperative patient, while I advocated for a PCA pump after noting the patient's history of sedation. I presented recent vital trends and facility protocols, and we agreed to trial the PCA with closer monitoring. By embracing each team member's expertise, maintaining open communication channels, and keeping the patient's needs central, I help create a cohesive environment where collaborative care thrives.
Tell me about a time you had to advocate for a patient. What was the situation, and what was the result?
One particularly meaningful example of patient advocacy occurred when I cared for Mr. Alvarez, an 82-year-old Spanish-speaking patient with heart failure who was hesitant to consent to a necessary echocardiogram. Despite the medical team's recommendation, he repeatedly refused, fearing the procedure would be painful and misunderstanding its purpose due to the language barrier. Recognizing his anxiety, I sat with him and used a qualified interpreter service, rather than family members, to ensure accuracy, to revisit the conversation. I learned he believed the test involved needles and would require him to stay overnight, which wasn't the case. Using visual aids, a simple diagram of the heart and an ultrasound probe, I explained how the non-invasive test would help tailor his treatment. I also arranged for him to speak with a Spanish-speaking cardiologist who alleviated his concerns about risks. However, advocacy extended beyond education. When Mr. Alvarez expressed frustration that his dietary restrictions, low sodium, made hospital meals unappetizing, I collaborated with a dietitian to modify his menu with culturally familiar options like grilled fish and sofrito-seasoned vegetables. This small change improved his nutritional intake and trust in the team. The result was transformative. Mr. Alvarez consented to the echocardiogram, which revealed worsening ejection fraction. The cardiologist adjusted his medications, preventing an imminent readmission. Post-discharge, I ensured his follow-up instructions were translated and scheduled a telehealth visit with his bilingual PCP. This experience reinforced that advocacy isn't just about speaking up. It's about listening deeply, removing barriers, language, fear, or cultural mismatches, and persisting until the patient's voice is truly heard. Mr. Alvarez's grateful handshake at discharge reminded me that these moments are why I became a nurse.
How do you handle receiving feedback, especially constructive criticism?
Receiving feedback, including constructive criticism, is an invaluable opportunity for professional growth, and I approach it with an open mind and a commitment to continuous improvement. I firmly believe that feedback, whether from colleagues, supervisors, or even patients, helps refine my practice and enhances patient care. When I receive constructive criticism, my first step is to actively listen without defensiveness, ensuring I fully understand the perspective being shared. For example, early in my career, a charge nurse observed that my handovers could be more concise to avoid omitting critical details during shift changes. Instead of taking this personally, I asked for specific examples and requested guidance on structuring my reports more effectively. I began using the ISBAR Identify Situation Background Assessment Recommendation tool to organize my communication, which not only improved efficiency but also strengthened team collaboration. I also reflect on feedback to identify actionable steps. In one instance, a patient's family member mentioned that my explanations about a treatment plan felt rushed. I realized that while I was thorough clinically, I needed to better gauge their emotional readiness to absorb information. Afterward, I made it a habit to ask, "Would you like me to go over this again or clarify anything?" This small change significantly improved their confidence in the care plan. Proactively, I seek feedback by regularly checking in with peers and mentors. This self-improvement is an ongoing process. If criticism is unclear, I ask questions to clarify expectations and demonstrate my eagerness to learn. For instance, after a performance review, I might say, "Could you share an example of how I could better prioritize tasks during high-acuity situations?" Ultimately, I view constructive feedback as a gift. It highlights blind spots and helps me align my practice with the highest standards. By embracing it with humility and a problem-solving mindset, I've been able to turn critiques into tangible improvements in my clinical skills, communication, and patient outcomes.
Tell me about a time you mentored a new nurse. What advice did you give them?
One of my most rewarding experiences as a nurse was mentoring Emily, a newly graduated RN who joined our medical surgical unit. While she was enthusiastic, I noticed she often hesitated during urgent situations, second-guessing her clinical decisions. Recognizing that her confidence needed nurturing, I took a structured yet compassionate approach to guide her. Early on, I emphasized that asking questions is a strength, not a weakness. During our shifts together, I encouraged her to voice uncertainties, whether about medication protocols or prioritizing patient care, and we'd debrief afterward. For example, when she was unsure whether to escalate a patient's dropping blood pressure, I walked her through my thought process, reviewing trends, considering possible causes like dehydration or sepsis, and deciding when to call the rapid response team. This helped her connect textbook knowledge to real-world scenarios. I also shared practical strategies I'd learned over time, like creating a personal cheat sheet for common emergency protocols or using the first 30 minutes of each shift to identify high-risk patients. We practiced time management techniques together, such as clustering care tasks to minimize interruptions. Beyond clinical skills, I advised her on self-care and resilience. After a particularly tough shift involving a patient's sudden deterioration, Emily confided that she felt responsible, despite following protocols perfectly. I normalized her feelings, sharing my own early career struggles, and reminded her that nursing is a team sport. No one bears the weight alone. We discussed mindfulness techniques and the importance of debriefing after difficult cases. The result was transformative. Within months, Emily grew into a confident, competent nurse who began precepting students herself. She later told me our check-ins helped her transition from feeling like an imposter to trusting my own judgment. This experience reinforced that effective mentorship isn't just about teaching skills. It's about fostering confidence, normalizing challenges, and creating a safe space to learn. Seeing Emily thrive reminded me why I love nursing. We lift each other up to provide the best care possible.
How do you contribute to a positive and supportive work environment?
Creating a positive and supportive work environment is something I prioritize daily because when our team thrives, our patients receive the best possible care. My approach centers on fostering collaboration, recognizing others' contributions, and maintaining a solutions-focused mindset, especially during challenging shifts. For example, I make it a habit to acknowledge my colleagues' efforts, Whether it's thanking a fellow nurse for assisting with a difficult for insertion or praising a tech for their attentiveness to a high-risk patient. Small gestures like these build camaraderie and reinforce a culture of mutual respect. During particularly stressful periods, such as staffing shortages, I've organized quick team huddles to redistribute tasks fairly and check in on everyone's workload. I also actively promote open communication. When conflicts arise, like disagreements over patient assignments, I address them constructively by listening to all perspectives and focusing on shared goals. Once two nurses were frustrated about uneven acuity distribution, I facilitated a discussion with our charge nurse to create a more transparent assignment system, which reduced tension. Additionally, I lead by example in embracing a growth mindset. When new protocols are introduced, I avoid negativity and instead collaborate with colleagues to troubleshoot challenges. Recently, our hospital transitioned to a new EMR system. While others resisted, I volunteered to train peers during lunch breaks, turning frustration into a team learning opportunity. Beyond daily interactions, I contribute to long-term morale by participating in wellness initiatives, like organizing monthly potlucks or advocating for mental health resources. Nurses who feel valued and supported provide better care, and I'm committed to being part of that cycle.
Describe a time you had a disagreement with a colleague or supervisor. How did you resolve it?
A memorable example occurred when I disagreed with a senior nurse about the pain management approach for a postoperative patient. The patient, who had a history of opioid dependence, was requesting higher doses of medication, while the nurse was concerned about potential sedation risks and preferred strict adherence to the standard protocol. I felt we needed a more individualized plan to balance pain relief with safety. Recognizing the sensitivity of the situation, I requested a private conversation to discuss our perspectives. I began by acknowledging the nurse's expertise and legitimate concerns, saying, "I appreciate how carefully you're monitoring for sedation. I know patient safety is our shared priority." This established common ground. Then I shared my observations. The patient's elevated heart rate and grimacing suggested undertreated pain, which could delay mobility and recovery. I proposed a compromise. Could we trial a lower-dose PCA pump with frequent assessments and consult the pain management team for guidance? We brought the physician into the discussion, who agreed to this plan. The patient's pain scores improved without oversedation, and the nurse later thanked me for advocating respectfully.
What are your thoughts on delegation? How do you decide what tasks to delegate and to whom?
Delegation is a critical skill in nursing that ensures efficient patient care while fostering teamwork and professional growth. I view delegation not just as task distribution, but as a strategic tool to optimize the strengths of each team member and maintain high standards of safety. My approach is guided by the 5 rights of delegation: right task, right circumstance, right person, right direction, and right supervision. When deciding what to delegate, I first assess the complexity of the task and the competency of the team member. For example, while I might delegate routine vital signs or ambulation assistance to a nursing assistant, I would retain responsibility for complex assessments or medication administration that requires my clinical judgment. I always consider the patient's condition. Unstable patients require my direct involvement, whereas stable patients allow for more delegation. Equally important is knowing my colleagues' skills and scope of practice. I take time to understand their experience levels and comfort zones. For instance, if I'm working with a newly certified PCA, I'll delegate tasks like repositioning or feeding after verifying their training, while providing clear instructions and remaining available for questions. With seasoned LPNs, I might delegate medication administration per facility protocol. Communication is key. I provide concise, specific instructions and expected outcomes, e.g., please check Mr. Lee's blood sugar before lunch and let me know if it's below 100. After delegation, I follow up to ensure completion and quality, offering feedback as needed. A recent example: during a hectic shift, I delegated post-op dressing changes to an LPN while I prioritized a deteriorating patient. I first confirmed the LPN's competency with wound care, demonstrated the technique, and later audited the documentation. This balanced workload ensured timely care for all patients. Ultimately, effective delegation is about trust, clarity, and accountability. It empowers team members, enhances unit efficiency, and keeps patient safety at the forefront.
Why are you interested in this position/organization?
I am deeply interested in this position because it aligns perfectly with my passion for delivering high-quality, patient-centered care while contributing to an organization known for its innovative approach and commitment to excellence. What particularly draws me to your hospital is its reputation for fostering a collaborative environment where interdisciplinary teamwork is prioritized, something I highly value as a nurse. I've been impressed by your hospital's pioneering work in implementing telehealth services for rural communities, and I'm inspired by how your team integrates cutting-edge technology with compassionate care to improve health outcomes. This role excites me because it offers the opportunity to grow professionally in critical care nursing, which matches my career aspirations to specialize in intensive patient care. I thrive in fast-paced environments where I can apply my clinical skills in complex cases while learning from a team of expert critical care providers. Your hospital's emphasis on simulation training and staff certification programs particularly resonates with me, as I'm committed to advancing my ACLS and critical care competencies. Beyond clinical excellence, I admire your organization's mission to serve diverse and underserved populations in our region. Having volunteered at free clinics during my training, I'm eager to bring my experience in culturally sensitive care to a team that shares my values of equity and accessibility. I'm confident my skills in rapid patient assessment, ventilator management, and family communication would allow me to contribute meaningfully to your ICU team while growing as a nurse leader. Ultimately, I see this role as more than a job. It's an opportunity to be part of an institution that sets the standard for critical care in our state, and I'm excited about the possibility of contributing to that mission while developing into a more skilled and compassionate critical care nurse.
What are your long-term career goals in nursing?
Nursing is not just my profession, but a lifelong commitment to growth and service. My long-term career vision integrates clinical mastery, leadership development, and meaningful contributions to healthcare systems. In the immediate future, I'm focused on achieving specialty certification in critical care nursing while deepening my expertise in managing complex cardiac cases. I want to perfect my ability to interpret subtle clinical changes and make rapid, evidence-based decisions that directly impact patient outcomes. As I progress, I see myself evolving into a clinical leader who bridges frontline experience with quality improvement. I'm particularly passionate about developing standardized approaches to reduce ICU-acquired infections and improve sepsis recognition. This transition from individual patient care to system-wide impact represents the natural progression of my career aspirations. What excites me most is the opportunity to mentor future nurses. Having benefited from exceptional preceptors throughout my journey, I want to create that same supportive learning environment for others. I envision establishing simulation training programs that help new graduates build confidence in high-stakes scenarios while maintaining compassionate care principles. Your organization's reputation for nurturing nurse leaders through structured development programs strongly aligns with these goals. The chance to contribute to your interdisciplinary research initiatives while growing under experienced clinician mentors represents exactly the professional home I'm seeking. For me, true career success means looking back in 20 years knowing I've elevated patient care standards while helping shape the next generation of exceptional nurses. This balanced approach, growing as clinician, leader, and mentor, reflects my belief that nursing excellence requires continuous learning at all levels. I'm committed to making this journey with an organization that shares my values of innovation, education, and uncompromising patient advocacy.
How do you cope with stress and maintain work-life balance as a nurse?
Nursing is inherently demanding, and over the years I've developed a holistic approach to managing stress that protects both my well-being and the quality of care I provide. At work, I practice proactive stress management by beginning each shift with a mental prioritization of my patients' needs through quick bedside rounds and reviewing care plans. This helps me maintain focus during chaotic moments. I found that taking brief mindfulness pauses between critical tasks, what I call clinical breathing spaces, allows me to reset mentally and approach each situation with renewed focus. The support of my interdisciplinary team is also crucial. We've cultivated a culture where debriefing after difficult cases or code situations is standard practice, creating both emotional release and valuable learning opportunities. Outside of work, I'm intentional about creating restorative routines tailored to shift work challenges. Regular high-intensity interval training helps me maintain physical stamina for long shifts, while my Sunday meditation practice grounds me before the workweek begins. I meal prep nutrient-dense lunches to sustain energy during 12-hour shifts, and I protect my sleep hygiene with blackout curtains and white noise machines for daytime rest. Perhaps most importantly, I've set firm digital boundaries. My work email gets checked only during shifts, allowing me to be fully present with family during downtime, whether that's exploring nature trails with my partner or coaching my nephew's soccer team. I've learned to recognize my personal early warning signs of burnout, like difficulty concentrating during medication passes or unusual irritability with colleagues. When these appear, I leverage our employee assistance program and use my well-being days strategically. I also maintain a reflection journal where I document both challenging cases and meaningful patient connections. Rereading these during tough periods helps reconnect me with my professional purpose. This balanced approach acknowledges that nursing stress is inevitable but manageable. Your hospital's innovative resilience training program and dedicated wellness spaces for staff demonstrate an organizational commitment to work-life balance that aligns perfectly with my approach. By combining personal strategies with institutional support systems, I've built sustainable practices that allow me to deliver compassionate care shift after shift while maintaining my own health, because the best patient outcomes begin with caregivers who are physically, mentally, and emotionally resourced.
What do you find most rewarding about being a nurse?
The most profound reward of nursing lies in those transformative moments where clinical expertise and human connection intersect to create meaningful change. What sustains me through long shifts isn't just the technical aspects of care, though I deeply value the intellectual challenge of interpreting lab results or titrating medications, but the privilege of guiding patients through their most vulnerable moments. One particularly vivid example stays with me. Caring for Mr. Thompson, a retired teacher with terminal cancer who feared becoming defined by his diagnosis. By taking time to learn about his love for jazz music, we transformed routine wound care into therapy sessions with his favorite Miles Davis records playing. The day his daughter thanked me for helping them find their father again beneath the medical equipment crystallized why I chose this profession. These opportunities to preserve dignity and identity amidst illness are gifts unique to nursing. I'm equally rewarded by the puzzle-solving dimension of our work. There's profound satisfaction in detecting subtle changes, a slight dip in blood pressure, a hesitant voice when describing symptoms that reveal larger clinical pictures. Like piecing together clues to adjust a diabetic patient's care plan until their glucose levels stabilize, then seeing their relief when they finally understand how to manage their condition. The longitudinal relationships in nursing are another irreplaceable reward. Watching NICU graduates return as thriving toddlers for follow-up visits, or seeing cardiac rehab patients regain their mobility, these arcs remind me that we don't just treat illnesses, we partner in healing journeys. Your organization's emphasis on continuity of care through specific program strongly resonates with this aspect of my nursing philosophy. Ultimately, what I find most rewarding is nursing's dual honor. We apply cutting-edge science at the bedside while never losing sight of the human being before us. It's this balance of intellect and heart, of fixing and comforting, that makes each day meaningful, even the difficult ones.
What challenges do you foresee in this role, and how would you address them?
One of the key challenges I anticipate in this role is adapting quickly to new clinical environments and systems, especially if it's in a different healthcare setting or country. Every facility has its own protocols, technologies, and cultural dynamics, so it's crucial to be flexible and open to continuous learning. To address this, I make it a point to familiarize myself with the institution's policies and electronic health records early on. I also proactively seek guidance from experienced colleagues and participate in any available orientation or training sessions to ensure a smooth transition. Another challenge could be managing high patient loads while maintaining quality care. In busy settings, it's easy to feel overwhelmed, but I rely on strong time management skills, prioritization, and clear communication with the healthcare team to stay organized and responsive. I also believe in the importance of self-care and mental resilience, which helps me remain calm and effective under pressure. Lastly, cultural and language differences can present challenges, particularly when building rapport with patients and families. I approach this with empathy, patience, and commitment to culturally sensitive care. When needed, I use translation services and visual aids, and I make a conscious effort to understand the patient's perspective and needs. Overall, I view challenges as opportunities for growth, and I approach them with proactive, solution-focused mindset that ensures both patient safety and professional development.
How do you ensure patient safety in your daily practice?
Patient safety is the foundation of everything I do as a nurse, and I maintain a vigilant, systematic approach to minimize risks throughout my shifts. My safety protocol begins with a thorough shift start verification process where I cross-check all assigned patients' medication lists, allergies, and care plans before any interventions. For high-risk medications like insulin or heparin, I employ the triple check method, verifying against the MAR during preparation, at bedside before administration, and again during documentation, a practice that caught a potentially dangerous dosing error last month when a decimal point was misplaced. I found that consistent communication is equally crucial for safety. During handoffs, I use the ISBAR format and include specific safety alerts like, "This patient is a high fall risk with left-sided weakness," rather than generic warnings. When starting for antibiotics, I always confirm the patient's identity using two identifiers and verbally review the medication's purpose with them. This caught a near miss when a patient with hearing impairment corrected my pronunciation of her name. Environmental safety checks are part of my hourly rounding routine. Beyond checking call lights and bed alarms, I scan for less obvious hazards like oxygen tubing, creating trip hazards, or monitor cords that could tangle during emergencies. After noticing several delayed responses to abnormal vital signs on our unit, I advocated for color-coded alert signs above high-acuity patients' doors, a simple change that reduced response times by 25%. Perhaps most importantly, I cultivate a culture where anyone can voice safety concerns without hesitation. Last week, a new nursing assistant questioned whether I'd washed my hands after removing gloves following a wound dressing. Instead of dismissing it, I thanked her publicly during our huddle, reinforcing that patient safety transcends hierarchy.
What makes you a great nurse?
What makes me an exceptional nurse is my ability to blend clinical precision with deep human understanding, a combination that transforms protocols into personalized healing. My strength lies in seeing both the subtle physiological changes that demand action and the unspoken emotional needs that require compassion. With 7 years of critical care experience across 3 countries, I've developed a nuanced approach to patient care. Just last month, while monitoring a septic patient, I recognized early signs of delirium that others attributed to routine confusion. By advocating for a urinary tract infection workup, we identified and treated the underlying cause before it escalated. This clinical vigilance stems from my commitment to evidence-based practice. I routinely review the latest research, recently completing an advanced certification in hemodynamic monitoring to better interpret subtle cardiac changes. Yet technical skills alone don't define great nursing. What truly matters is how we apply them. When caring for a terminal cancer patient who resisted morning care, I discovered his lifelong habit of reading the newspaper with coffee first. By adjusting our routine to honor this ritual, we transformed resistant encounters into cooperative moments of dignity. These experiences taught me that healing occurs not just through medications, but through preserving identity and choice. My colleagues would describe me as both a clinical anchor during emergencies and a unifying presence during shifts. During a recent night shift short staffing crisis, I reorganized our patient assignments by acuity rather than geography, allowing us to maintain safety standards while supporting overwhelmed teammates. This balance of leadership and teamwork reflects my belief that exceptional care requires both individual excellence and collective support. Your hospital's reputation for merging cutting-edge technology with compassionate care particularly resonates with me. The opportunity to contribute my ICU expertise while learning from your interdisciplinary team represents exactly the environment where I can continue growing as a nurse. At its core, what makes me great is this dual commitment to master the science of nursing while never losing sight of the human beings we serve. Each day, I strive not just to competently perform tasks, but to thoughtfully create moments that restore health, hope, and humanity.